Aging and Hearing Loss, Presbycusis by P L Dhingra. Population of the elderly people is increasing and so are the challenges being faced to rehabilitate them. Aging affects all the systems and organs of the body, be it visual, auditory, vestibular, cardiovascular, musculoskeletal, or central nervous system. Depending on age, about 30 to 40% people suffer from hearing loss. This affects them on social interaction, leading them to isolation, withdrawal, and later depression. Even the persons who communicate with them get frustrated and try to avoid them. Pathology. Age related anatomical changes have been seen in cochlea on histopathology. Harold Frederick Schusnetz described four types of changes. 1. Atrophy of sensory cells of the organ of Corti. 2. Reduction in number of cochlear neurons. Nearly 2,100 neurons are lost every 10 years starting from birth. 3. Atrophy of stria vascularis. 4. Stiffening of basilar membrane leading to cochlear conductive deafness. Arthritic changes in ossicular joints also observed. Differential diagnosis. It is not just the age related changes in the cochlea, but an elderly person is prone to all the diseases that are caused in a young person, such as the Meniere's disease, noise induced hearing loss due to head trauma, autoimmune disorders, autotoxic drugs, autosclerosis, hypothyroidism, viral and vascular diseases, acoustic neuroma, HIV, or sexually transmitted diseases. These must be excluded before establishing diagnosis of age-related hearing loss. Diagnosis. A thorough history and physical examination is essential. Diagnosis of presbycusis is by exclusion. Examination should exclude diseases of external and middle and other causes of sensorineural hearing loss as listed earlier. Incidence of impacted wax in the canal is very commonly seen in the elderly due to atrophic changes in the secretory activity of the ceremonous and modified sweat glands leading to drying of wax. Normal mechanism of migration of wax is also disturbed. Growth of tragal hair in the elderly males further impairs expulsion of the wax from the canal. Investigation. 1. Pure tone audiometry indicates the degree of hearing loss and frequencies affected. 2. Speech audiometry shows poor discrimination scores out of proportion to pure tone hearing loss. 3. Other tests are as mandated to exclude other diseases. Rehabilitation of person with age-related hearing loss. It can be done by 1. Hearing aids. The hearing aids help to amplify sound. The selection of hearing aid is important and depends on type and severity of hearing loss. Unfortunately, many elderly persons stop using hearing aids after some time. Only about one third may be successfully using them. This is because of financial constraints of cost and maintenance of hearing aids, social stigma of using the aid, loss of dexterity to manipulate the controls of the device, too little benefits due to feedback phenomenon and amplification of ambient noise. Cognitive deterioration and memory loss further add to the problem. In the use of hearing aid, increasing the signal to noise ratio is very helpful. Hearing is better when ambient noise is cut down. Also, it is helpful if the person speaker faces the patient. 2. Cochlear implants. They have been found useful in severe bilateral hearing loss where hearing aids are not accepted or found to provide no benefit. 3. Semi implantable hearing aids such as vibrant sound bridge which move the ossicular chain directly, thus keeping the ear canal free from intrusion of a tube or mold. Bone anchored hearing aids are also available for conductive losses. Costs of semi implantable aids may be a deterrent. See Chapter 20, Rehabilitation of Hearing Impaired. 4. Sound bridge for conductive hearing losses and unilateral hearing loss. 5. Assistive and alerting devices. Thank you.